You so much for coming to hear my talk today, and thank you so much for inviting me to do this talk. So first, I'd like to acknowledge the members of the Cognitive Recovery Lab at Georgetown University who were all very essential to this work: Candice Vanderstelt, Andrew DeMarco, Alicia Lax, Cassandra Dobbins, Sarah Schneider, and Peter Truckeltaub, as well as Lauren Brock and Sophia Balila-Roeder at the MGH Institute of Health Professions, and this work was supported by funds from the NIDCD. So before I jump in, I wanted to provide some context for this work so you can kind of imagine what my headspace was like and my frames of reference in terms of how the research question was constructed and how the work was carried out. So I got my bachelor's, my master's degrees in speech pathology, and then I worked as a full-time speech therapist, mostly in medical settings, with adults with neurogenic communication disorders from 2014 to 2018. And my number one love was aphasia, basically from day one of undergrad. And then I started in my PhD program in 2018 and just finished my doctoral studies this past summer. And now I'm doing a postdoc studying longitudinal recovery following left hemisphere stroke. So all of that to say, I had some really excellent clinical experiences that very much, if not entirely, inform my research. And so this idea was really born from a lot of my observations of people with aphasia who use circumlocution really effectively and how they seem to navigate their aphasia differently from those who struggle to use circumlocution. And I also feel like I should qualify this talk by acknowledging that this idea is pretty simple and the analyses are pretty simple as well. So while it's not a complex idea, I think there's a lot of value in its simplicity. So with all of that in mind, I will go through some of the background. So as we very well know, discourse analyses are used to assess people with aphasia's language ability at the spontaneous speech level. These approaches yield scores that are thought to capture the person's communicative effectiveness or their functional communication ability in everyday life. Despite their ability to capture functional communication, they are more frequently used in research than in clinical settings due to clinicians' valid concerns with their practicality and efficiency. Clinician-reported barriers to implementing discourse analyses in their clinical practice include the time required to collect, analyze, and interpret the samples, feelings of not possessing the skills or the knowledge necessary to accurately perform the analyses, and a lack of consensus on which types of elicitation approaches offer the most representative measure of everyday functional language use. So ultimately, despite their functional diagnostic value, these measures are generally underutilized in clinical settings. To address this issue, researchers have sought to estimate the relationship between word retrieval at the confrontation naming level and performance at the discourse level, with the intention to use naming performance to predict or estimate discourse level performance. Naming assessments are used widely in clinical practice. They require less time to score and interpret, and naming scores have been found to correspond with the overall integrity of the language system, so they're thought to offer a pretty optimal measure with which to estimate discourse. Previous work that has examined the relationship between naming and discourse, there's an excellent review by Jessica Richardson and colleagues where they reviewed studies that compared naming and discourse, and the studies used a variety of naming tasks, of discourse elicitation measures, and discourse outcome measures, but on the whole found that positive correlations between naming performance and discourse production are relatively strong, but vary from low to high. So as we know, in order to estimate or predict some outcome, we want to identify predictor variables that account for large proportions of the variance in that outcome. And the more variance that can be explained, or the more variability that's associated with the relationships between the predictors and the outcome variables, the more precise that our estimations can and will be. So currently, naming performance has been found to explain a proportion of the variance in discourse outcomes, but proportions of the variance remain unexplained. So we proposed that perhaps naming performance could account for more of the variance in discourse outcomes if the two were measured a bit more similarly. So the fact that naming performance doesn't account for more of the variance could be due in part to the differences in how these two levels of production are traditionally measured. More specifically, in this case, naming is scored based on accuracy, whereas discourse is often based on more than just accuracy. So take, for example, correct information unit or CIU analyses. CIU analyses are one of the most frequently applied discourse production measures. They've been discussed as quantifying how well a person communicates information to listeners, regardless of how closely their productions conform to standardized rules and patterns. They are defined as words that are intelligible in context, accurate in relation to pictures or topics, and relevant to or informative about the content of the picture or topic. Therefore, to be counted as a CIU, a word doesn't necessarily have to conform to a predetermined set of standardized noun and verb tokens, which allows for a wider array of verbal productions to contribute to a CIU measure. This approach has proven effective because CIUs have been found to correspond with listeners' perceptions of the speaker's informativeness and are therefore thought to provide an ecologically valid measure of someone's communicative effectiveness. Conversely, when naming performance is quantified, responses are typically measured using a simple dichotomous scale of correct or incorrect. And this results in naming outcomes that account for a more constrained array of response types than a discourse outcome like CIUs. And so what I'm trying to highlight here is just the simple fact that there are different types of responses that contribute to these two types of outcomes. So for example, if when describing a picture scene in which there was a kite and a person with aphasia produced the word kite during their sample, that would be considered and counted as a CIU. Similar if they produced kite in the context of a naming assessment where kite was one of the targets. Since it matches the target word, the person would receive credit for that response. Okay, so now let's say in the context of a discourse sample, the person wanted to mention a kite, but was unable to retrieve the specific target word in that moment, and instead said, up in the air, on a string, they're holding it. So even though they didn't say the word kite, they still would receive CIUs, or those would be counted as CIUs, because those verbalizations are intelligible in context, accurate in relation to the picture, and informative about the content of the picture. However, if they were to say that exact same thing in the context of a naming assessment, that really information-rich circumlocution response would be counted as incorrect. And if the clinician or researcher was doing an error coding, it may be coded as a circumlocution or a description error, but that would, of course, still not contribute to their overall score of naming. And so what I'm trying to highlight here is that if we intend to use naming performance to estimate discourse, it's important to consider what types of responses get factored into these two outcomes. So in this case, I'm trying to make the argument that one of the potential reasons that naming performance doesn't account for more of the variance could be because it has a more constrained array of response types that get factored into its score. So when we consider other types of verbalizations during discourse and naming assessments, like paraphasias, for example, these types of responses are more or less handled similarly between the two, discourse and naming. A paraphasia would not be counted as a CIU, and a paraphasia would not be counted as correct in the context of a naming assessment. So really, there is agreement in how correct responses and most incorrect responses are handled between these two assessment types. However, there is a bit of a disconnect between how circumlocution or description responses are handled between the two. And so we hypothesized that circumlocution may be an important factor to consider in the endeavor of using naming performance to estimate discourse. And so the simple idea here was that perhaps if we quantify circumlocution at the single word level and include that measure in our analyses in which we're using naming performance to estimate discourse, we may be able to explain a significant amount more of additional variance in outcomes. Reason being that circumlocutions typically contain words that are accurate, relevant, and informative about targets, similar to the types of productions that are counted as CIUs. From a functional communication standpoint, circumlocution has been found to assist in listener comprehension in moments of anomia. So, for example, there is this really great study by Connie Tompkins and colleagues in which they found that when people with aphasia produced descriptions of objects' use, function, and outward characteristics in the absence of target word production, observers were able to guess correctly or predict the intended targets in as many as 70% of instances. And so if you look at this figure here, participants 4 and 7 both had pretty low independent word retrieval accuracy, but when we consider how well observers were able to predict the intended targets, we see a really big jump, which is, that's a pretty big jump between their accuracy and observer success with predictions. And generally, the same benefits to listener comprehension have not been found for paraphasias, neologism, stereotypies. So we wouldn't expect to see that those types of productions would increase listeners' predictions. In fact, the presence of those types of productions in discourse and in naming have been shown to yield lower listener perceptual ratings of clarity, organization, and intelligibility. So in this study, we aimed to test the prediction that the inclusion of circumlocution into predictive models of, specifically in this case, communicative informativeness and communicative efficiency would account for a significant amount more of the variance than models containing naming accuracy alone. And we further predicted that the subsequent inclusion of other types of error-coded productions, like paraphasias, would not account for a significant amount more of the variance in discourse outcomes, in these two specifically. Okay. So the data used in the study were collected by members of the Cognitive Recovery Lab at Georgetown University as part of the Brain-Based Understanding in Individual Language Differences After Stroke, or the BUILD project. And there were 43 participants who had complete data at the time of our analyses. To be included in the sample, people had to have had a single left hemisphere stroke, be 18 years of age or older, have learned English at 8 years of age or younger, be classified as having aphasia according to the WAB-R aphasia quotient, and they could not have other brain conditions that could impact result interpretation. And I've included some basic demographic information for the 43 people that were included in this study. So to assess naming performance, the participants completed a 120-item naming assessment in which they were shown pictures and were simply told to name the object. Using a formalized scoring and coding protocol, each naming response was coded for accuracy and for type of response. So incorrect responses were either coded as description responses, real word errors, non-word errors, stereotypies, or perseverations, and the description responses constituted our measure of circumlocution. 10% of the naming data were scored and coded by a second blind rater, and the inter-rater reliability for the naming accuracy and type of response were both strong. To assess discourse performance, Participants were asked to describe two pictures, the WAB-R picnic scene and the BDAE cookie theft picture. And I'm sure some of you may be wondering why two picture description samples were collected and why something like a procedural or a narrative discourse sample wasn't collected. And that's because this particular study was done retrospectively. And so these were the discourse elicitation prompts that were included in the original protocol. So from these pictures, the participants' descriptions were recorded, transcribed, and coded, and analyzed to yield the discourse measures that I will describe again in a few slides. To ensure reliability for the discourse data, about 35% of the samples were reviewed and verified by a second coder. So we compiled the naming accuracy and response type results to give us the predictor variables for our models, which I have here on the slide. Everyone had a % correct, and then the proportion of incorrect responses that were descriptions, real word errors, non-word errors, stereotypies, and perseverations. And then for the discourse outcome variables, we had % CIUs, which is thought to be a measure of informativeness. And we used the % CIU calculation described by Nicholas and Brookshire, in which the number of CIUs is divided by the total number of words. We had CIUs per minute as the other outcome variable, which is thought to be a measure of efficiency. And again, we used the calculation from Nicholas and Brookshire, in which the number of CIUs is divided by the total amount of time spoken. I can also mention here that % CIUs has been used as an outcome variable in prior work that has sought to estimate discourse using naming performance, but no studies to our knowledge have used naming to estimate or predict CIUs per minute. For our statistical approach, we used hierarchical regression for both of the models, for the efficiency and the informativeness model. And as a reminder, hierarchical regression is a framework for model comparison. So for the informativeness model, at step 1, we entered in naming accuracy, since this is an established predictor, an established and known predictor of informativeness. In step 2, we entered the proportion of incorrect responses that were description responses. And we added this at the second step to evaluate the unique variance that circumlocution would account for after controlling for naming accuracy. And then at step 3, we entered the other types of error productions. And then we compared the 3 models using an ANOVA to see if step 2 and/or step 3 would account for a significant amount more of the variance in % CIUs. And then we conducted the same 3-step hierarchical regression for the CIUs per minute outcome. So before running the models, we assessed for univariate outliers on our outcome and predictor variables, and 2 cases were identified as univariate outliers. Then we assessed for multivariate outliers by calculating Mahalanobis distances, but no cases were identified as multivariate outliers. And the 2 univariate outliers were retained at this point with the intention of assessing for influential cases after running the models. We assessed for multicollinearity with a correlation matrix, and no correlations between the predictors exceeded 0.6, and thus were deemed to not be too highly correlated with each other. We also evaluated for influential cases and examined plots of the residuals, and ultimately we decided to use a robust function to run the actual models themselves. Okay, so just letting you know, the results are very light. So first, for our % CIU outcome, we found that naming accuracy was a significant predictor of % CIUs, which is consistent with prior work. And then adding our measure of circumlocution to the model significantly increased the amount of variance in % CIUs that the model explained. And then adding in the other predictors to the model did not. And so this shows us that in addition to naming accuracy, circumlocution at the single word level was a significant predictor of percent CIUs at the discourse level in our sample. And then very similar pattern for the CIUs per minute model. The model that contained the proportion of incorrect responses that were descriptions accounted for a significant increase in the amount of variance in CIUs per minute compared to the model with naming accuracy only, but the inclusion of the other error response types did not. And this shows us that circumlocution at the single word level was a significant predictor of someone's ability to produce informative content efficiently at the discourse level. All right. I may need to take a water break in a second. So overall, in our sample, we found that the addition of circumlocution responses in the informativeness model contributed a small positive but significant increase of 1.5% of the variance in CIUs, and while small, establishes that circumlocution accounts for a unique proportion of the variance beyond naming accuracy, and thus may be a meaningful behavior for us to measure when we're attempting to estimate informativeness. We also found that the addition of circumlocution responses in the efficiency model contributed a relatively large and significant increase of 8.3% of the variance in CIUs per minute, which also establishes that circumlocution accounts for a unique proportion of the variance in communicative efficiency. So lots of things to consider here. First is that circumlocution may be even more predictive of informativeness and/or efficiency than our results demonstrate. Standardized naming assessment instructions were used in this study, in which participants are told to respond using only one word and are only given a short time frame in which to make their response. So these specific aspects of naming task administration could discourage circumlocution and therefore likely don't elicit as much circumlocution as an intentional measure of circumlocution could or would. And although we did capture naturalistic circumlocution behaviors, it could be that some people actively stopped themselves from circumlocuting during the naming assessments. So a naming assessment without imposed time limits and with explicit instructions to describe targets in moments of anomia would likely yield a more representative measure of someone's circumlocution ability. Further, it could be that other types of discourse elicitation procedures, like dialogues or unstructured conversation, would yield different types of samples and may reveal differential relationships between circumlocution during naming and discourse outcomes. And also, while we chose to use percent CIUs and CIUs per minute in this study, there are lots of different discourse quantification methods. Circumlocution may differentially contribute to predictive models on such outcomes and may be more predictive of certain outcomes than others. I personally like CIUs because I think they're one of the less prescriptive of the discourse analysis approaches, but it would be beneficial to evaluate whether this relationship between circumlocution and discourse holds up in other types of outcomes. Future work may also explore whether circumlocution is differentially predictive of discourse level communication depending on aphasia subtype. So prior work has found that lexical retrieval at the single word level is more predictive of gist production for people classified as having Broca's and Wernicke's aphasia compared to those classified as having anomic or conduction aphasia. Another, perhaps more important consideration is the potentially informative content that's present in certain productions that are currently regarded as paraphasias. So for example, a lot of naming assessment scoring criteria dictate that a superordinate category word is coded as a real word error, while a type response is coded as a description. So if you show the person a picture of a grapefruit, for example, and they said fruit, that would be coded as a real word error. But then if someone said instead type of fruit, that would be coded as a description just based on the presence of the words type of. So it could be that a person with aphasia who says fruit is providing the superordinate category for the picture as a circumlocution, but due to the absence of the words type of, their production is getting categorized as a different type of error. So future iterations of this work may wish to allow for other types of productions that have descriptive content but lack the grammaticality required to be considered as descriptions based on their intonation and pauses that may indicate a clear word searching behavior. And finally, no discussion that includes mention of standardized assessments is complete without an acknowledgement of the racial, ethnic, and cultural linguistic bias that is inherent in many of the standardized tools that we use to assess people with aphasia. There is ample evidence of performance discrepancies between racial and ethnic groups on the BNT, the WAB, and the BDAE, which are thought to arise from differential item functioning, linguistic and format bias, and the use of predominantly white middle-class validation samples. So therefore, results from such assessment tools, when used to assess Black, Hispanic, and Asian people with aphasia, as well as people with aphasia from other racial and ethnic backgrounds, or people who don't speak standardized English as their primary dialect, should be interpreted cautiously through this lens. So to minimize this type of measurement error in this study, the Philadelphia naming test was chosen because it's known to be less affected by participant factors such as race and socioeconomic status. And scoring rules were also used that do not penalize speakers of dialects that are not the standardized English dialect. However, it is still a factor to think about. And if anyone went to Dr. Dave Trina Celeste Gatson's talk at the Clinical Aphasiology Conference back in May, or her talk at ASHA back in November, you may remember the information that she presented on the cultural relevance or irrelevance of many of the stimuli that we use to elicit discourse samples when used with Black and African American people with aphasia, like the cookie theft picture and the Cinderella story. So it's likely that the pictures and prompts that we use are also introducing some form of measurement error into our work. So the cultural linguistic bias in discourse elicitation procedures gives even more of a reason for future work to evaluate the relationship between circumlocution during naming and discourse using a wider variety of discourse prompts that are perhaps more culturally relevant to our patients and our participants. Overall, future investigations predicting discourse level production with circumlocution during naming that are using tools that have known cultural linguistic bias should attempt to account for this bias or account for this source of measurement error, or should preferably use tools whose scores are less impacted by factors such as race and cultural linguistic background. And I misspoke. So overall, in the future, any work that's trying to predict discourse with confrontation naming scores, you should preferably use tools that are less biased, and or you should account for that measurement error in your analyses. So to conclude, in this study, we found preliminary evidence that including a measure of circumlocution into predictive models improved our ability to estimate informativeness and efficiency. And this preliminary evidence may improve clinicians' ability to use naming assessment performance to estimate their patients' functional communication effectiveness by using a tool that is already used very regularly in clinical practice. And kind of as an aside, I would also love to see a shift away from discussing circumlocution as an impairment symptom and towards discussing it as an adaptive behavior. Overall, there is so much communicative value in circumlocution, and I think it deserves some more consideration, especially in terms of how we are measuring outcomes from treatment or a person with aphasia's recovery over time. And so that is the end of my talk. And I also wanted to just recommend a follow on Twitter. Warda is a speech therapist in the UK who tweets a lot about speech therapy practices in a very thought-provoking way, and a lot of the thoughts and ideas related to this study were informed by a lot of what I've heard her speak about and tweet about. So wanted to end with that.
Thank you so much. That was an excellent talk. Thank you for this important work. Does anybody have any questions? Please feel free to put them in the chat. Yes, I can get started with my question. Victoria, in the data set that you had, I was curious to know how many of these folks were using circumlocutions? Were there people who were not using circumlocutions?
Yeah, there were. Let me pull up my table. I have another table that has more of the information on. So the mean percent of incorrect responses that were circumlocutions was 8, with a range of 0 to 46%. So the most was one person of all their incorrect responses was producing circumlocutions in about half. And then a few people didn't produce circumlocutions at all.
Thank you.
Oh, okay. How much of it was verbal or gestural? So Alicia, correct me if I'm wrong, but I'm pretty sure that it was all verbal. I don't think that any gestural circumlocution was factored in. It was all the verbal responses.
I always find that fascinating because there's so much circumlocution that happens in gesture. That's really, really interesting. So I wonder if that might be a fun thing to put in, especially for those individuals who might have some like apraxia of speech that's really impairing their ability to circumlocute well.
Yeah.
Might be a fun thing to add into the model, see if it improves it a little bit too.
I think that's a really good thought. And the study that I highlighted, the one by Connie Tompkins, they did have gestures as one of their as one of the things that people were permitted to do. And so they would play the videos of the participants to the listeners. And so it was gestural and verbal altogether. Oh, okay. Alicia says that
cool.
Yeah, gestures were coded.
Very cool. My other question was, to what extent do you think that circumlocution is used as a strategy by some versus more of a, I don't know how to say this, like a successful strategy that they've been taught, or a strategy that maybe is less successful when they could be producing an item? Like, it's a tricky little situation here, but like, do you think there's a difference, I guess, in how people are using circumlocution, and is there a difference whether it's being used kind of as a conscious strategy versus not, I guess?
Yeah, I think in the case where someone is, I think in the context of a naming assessment, it's more than likely that the person is using it as a self-cueing strategy as opposed to a functional communication strategy to the tester. But ask me the second part of the question again.
Yeah, I'm wondering if they kind of have self-awareness as to why they're using it, basically. To your point, is it for the other person or is it for them as like a self-cueing strategy? I kind of wonder if there's a difference.
Yeah, I think I just very anecdotally, I would say in a naming assessment, it is probably being used as a self-cueing strategy.
I sometimes just have people like really want to demonstrate competence, and they know that they don't know the word. And so it's very much like, but I'm going to show you my competence. Like I do know, like everything about it. So I wonder if sometimes it's not self-cueing, but it's hard. It's a hard nuance, right?
No, I think that's a really good point. And then there are the people who will also tell you what they know that it's not, I think in a similar way, to be like, not dog, not cat, the other thing. But yeah, that may be like on an item by item basis or a person to person basis of how and why they're using it.
All right, I'll stop asking questions.
Hello. I really enjoyed your talk. It was great. I applaud your enthusiasm for circumlocution and seeing it as a, you know, as a tool and a good thing versus a, take that tick mark. So I did want to ask the effect of language context. So you suggested that if you'd used a different task, so, you know, describe an important event or some different language context, what you think the results could be and why. I mean, are you planning on trying a different context or?
I think it would be a good idea to test the relationship across. I know that there's a lot of correspondence between different types of discourse elicitation measures with specific outcomes. So I don't know that there would be one, I can't say that I think that one type of elicitation procedure would allow someone to be more informative than another. I guess it would just depend on the person and the prompt. Do you have thoughts about that?
I would say there's a little bit more context when you have, you know, the cookie theft versus picnic scene versus if you're looking at them in a conversation setting, which I've often seen as being not familiar with the topic or the, you know, object that they're talking about. It's hard. Even though they are sometimes circumlocuting, I've seen it go, you know, it's 50-50. Sometimes they're successful, sometimes they're not.
I have not used this, but I know it exists. Marion Lehman and Lisa Edmonds created a CIU specifically for unstructured conversational samples. And so I think it would be interesting to see how this relationship appeared in an unstructured conversational type sample.
Yeah, I would almost think that the cookie theft and Cinderella, where it's very visual and it's almost more, it seems more related to a picture naming / confrontation task, that there would be a tighter correspondence or a, you know, they'd be more related and more predictive than a more unstructured context. But it would be an interesting question.
That's a good point. That is a very good point. The fact that it's primarily object-based, that is a good point.
I have a question, although I'm not too sure if I'll start with it. But so I know that you have some experience with assessing individuals and their naming ability and looking at circumlocution and how it changes over time.
Mhm.
I'm really interested by your comment that perhaps there could be different ways in naming assessments where circumlocution was more encouraged, like there wasn't time constraints or it wasn't told like you need to be accurate. Have you noticed when you're working with individuals and assessing naming over time, do people tend to, have you noticed that people tend to restrict their attempts to circumlocute during the assessments before you kind of train them on circumlocution?
In my experience in the research context, I would have to really go back and think about what it was like clinically. It seemed to me that either this was going to be a person who would try to circumlocute regardless of the time constraints given, versus a person who sees the item, they say to themselves internally, I don't think I'm going to be able to retrieve the word for this target, so they may just say, bye, Alicia, thank you. They may just say, next or skip or just go on, because I think implicitly they understand, okay, we've got a lot of these and I kind of need to just move on, and I'm not going to take all of the time and effort for each of these items to give it my all. So that to me really was like a person to person thing as opposed to an item to item thing. But in terms of or were you asking like what people would do if they had more time, or yeah, tell me what you were asking.
Yes, and if you've noticed differences when you encourage people to circumlocute, but maybe without the training piece, and that's why I think it might be hard to describe though. Do you find that it's like those people who tend to circumlocute were circumlocuting already kind of in that personality way, or that there are those people that just need to be encouraged and then they'll feel like it's okay to circumlocute on an assessment that's traditionally right, wrong.
Yeah. I think you are touching on another study that I did where we in therapy really reinforce the idea that target retrieval is not the end all be all. There is a lot of value in verbally circumlocuting to yourself and to listeners. And so after we had done this training, all 4 of the participants who completed the entire training were circumlocuting significantly more after therapy, and the task instructions for the naming assessment didn't change at all. So at no point during the naming assessment did we say, and remember, if you can't think of the word, use your strategy. It was something that they were doing independently more. And so I think some people were using it before. Maybe if they get some encouragement, they will use it even more frequently. But then the people who maybe didn't know that that was accessible to them, they didn't know that it was permitted. If you give them the space to kind of feel it out on their own, I think that they would do it more. And I think some people just know their aphasia well enough to know, like, even if it's someone who does it a lot, sometimes they're going to look at an item and just be like, no, it's not happening. So yeah.
This is exciting. I'm excited to see more on this. I'd love to also see different communication partners explored too, just because I feel like circumlocution is so commonly used with unfamiliar people. Again, I think as a competence demonstration, it'd be really interesting to empirically look at that, like how often someone circumlocutes when they're with someone they know really well, communication partner, versus in other scenarios, I think would be fascinating.
And the types of things that they say in their circumlocution. There was one of my research participants, he frequently had his really close friends come to the sessions, and he would look at a picture and look at them and be like, remember New York 1987? And they would be like, oh, ha, ha, ha. And it would
I
be
love that.
Like a sponge. And it's like, there's some inside knowledge here that
it's common ground, right? It's like that classic building of common ground, which is really cool.
And Kathy asked, in what direction do you plan to take this work? Maybe a platform on viewing circumlocution in a positive light? I think there are so many possible directions to go from here. So the other study that I refer to, it was an SFA treatment with this added metacognitive strategy training component in which circumlocution was really reinforced throughout treatment, and people were told, why you do it, how it can be effective. And so what we have a bunch of data on their pre and post-treatment naming performance. And so I was thinking it would be really interesting to take their pre-naming verbalizations and have listeners listen to their descriptions, and kind of similar to the Tompkins paper, see how many times people are able to accurately predict. And what I would bet is that it would be kind of similar to her findings, in which some people's accuracy was really low, but they're really effective circumlocutors. One of the participants in particular, we had 176 items on this naming assessment. He circumlocuted, I think at the highest was 111 of the items, and his accuracy was below 10% before and after treatment. But post-treatment, he was circumlocuting so much more frequently. So I think if we are able to publish studies that show the functional benefit of circumlocution, I think that would perhaps shift things a little bit. And there was another thought that I had, and I'm not remembering it now, but maybe it'll come to me as I'm sitting here. Oh, actually, I think I remember what I was going to be. So the other part of this is, I think it's been indirectly programmed into a lot of people with aphasia that they shouldn't be doing it. And so I think not only are we going to have to advocate within because I know that clinicians know the importance. I know that clinicians do reinforce the benefit of circumlocuting during therapy, but I think not only demonstrating that to our fellow researchers, but also to our patients with aphasia. The two of the gentlemen that were in my study who had the most chronic aphasia, even in the therapy when they would be circumlocuting really effectively, they would basically express to me, I know that's good, but like I don't care. I just want to say the word. And it's like, yes, I hear you, and I am not saying that you shouldn't try, but if any single person were to sit across this desk from you and try to guess what you're talking about based on your descriptions, I think that 99% of people would be able to understand you really well. And isn't that really meaningful? If someone is able to successfully guess what you're talking about, you've gotten what you've needed to get, or you've gotten what you wanted to say. So I think also reframing the types of things that we are trying to improve in therapy and why we're trying to improve them and how those skills transfer to everyday life. So I think the research side and then also the people with aphasia side, really just trying to restate the value in circumlocution and demonstrate it to them as opposed to just saying it, because I think they're like, yeah, that sounds great, but until they start having success circumlocuting, it may not be as meaningful, and I would get that.
I agree. There's this really nice paper by Sharon Antonucci, I think in 2009. She talks about semantic feature analysis, but the goal of that, it's in context of group therapy, but the goal of it is not only to improve word retrieval, but also to teach them the strategy of circumlocution, something that they can take with them after therapy ends. And so I think it's also important for clinicians to realize that, that it's not only focusing on, of course, strengthening the lexical semantic connections, but also using that as a strategy moving forward.
Yes. Yeah, I agree. I think I know the paper you're talking about, and I think using SFA in a group context is even a more effective way to demonstrate the value of circumlocution, because there are people that are giving you like real-time feedback of how you're doing with your circumlocution in a different way than a one-on-one therapy session where you as a clinician already know what the person is trying to say. It's kind of like a constraint-induced language therapy situation, but a little bit different. And yeah, I have
I'm just trying to find that.
yeah. There's another there's a paper by Kathy DeLong, and that talks a lot about the strategy component. I can oh, did you get it, Kristen? Oh, this is the Antonucci. Okay, let me find the other ones and I can put them in the chat.
Thank you, Kristen. All right, while Victoria's finding it, I just wanted to ask if anybody else in the audience had any questions. This was a great talk, and this was a great discussion. Thank you so much for your time and this presentation. It's very, very important.
Thank you. Thanks for listening, and thanks for the questions and for the conversation. I am really glad to have spoken with you all.
Thank you.
Bye. All
I
right.
just wanted to stay on and see anything you